I'm here today with Dr. Stuart Carr, one of the leaders in oral immunotherapy across the entire Middle East. Welcome, Dr. Carr, to Immunity Group Australia podcast.
Thanks for having me.
So what is a good-looking Canadian doctor doing in Abu Dhabi? How did this transition from Canada to Abu Dhabi for you happen?
I mean, it's an interesting story because if you would have told me 10 years ago that I would be here in Abu Dhabi now, I would have laughed and it never would have been on my radar. I had been in practice in Canada for about 20 years and I got one of the sort of, headhunter recruiting emails that we get from time to time, and mostly we ignore them. And for whatever reason, this one sort of caught my eye. I guess after 20 years in practice, it's either do something different for a while or you just keep doing the same thing for 20 more years. And I had a great practice. I enjoyed it tremendously, great patients. I loved the area I was in. It was where I had grown up and my family was there. But sometimes a change is good. And so this was an opportunity that came up. The best thing about this opportunity was that the people that were organizing it and developing it, because it's a really novel concept to have a dedicated allergy focused clinic in the region. Their vision was to try to bring the kind of practice that I was already doing, which was focused on, more quality of care rather than patient volume, quantity of care, trying to make as much money as you could make. I was very adamant that, we practiced a very certain way. We wanted to make sure we were taking appropriate time with our patients and providing comprehensive care, not just, skin test and send out the door kind of approach. And they had the same vision and they were very receptive to the things I was doing, including we had already started an immunotherapy program in Canada then, and they were quite happy for me to continue basically doing what I was doing in Canada, but here in the Middle East instead.
So when you came and joined the team in Abu Dhabi, there was a huge sort of burden in a way of responsibility because you are the first. How did that feel?
It not knowing the region well and not knowing all sort of the political ins and outs of the way the healthcare system works here was a bit eye-opening for me, and there was a learning curve, but it really wasn't much different from what I had already done 20 years before that when I started my practice back home in Edmonton in Canada. I had trained in a center in Winnipeg where allergy had a strong presence and was well represented in the community and well respected, and people knew who to refer to the allergy clinic, and we they knew what we did well and what we didn't do. And in Edmonton, it was not like that. There were very few allergists in the community. None of them were doing things like food challenges in children. And it really was a completely barren feel. So I already had that experience of sort of establishing a new clinic that was doing things in a very different, sort of up to date, evidence based way. And it takes a while to establish that. It took the better part of 4 or 5 years back in Canada to establish that in an area that had really not experienced that previously. And so it's very similar here. It was very much just kind of like going back in time and redoing what I had already done before.
So when you were building your team, what was the priority when you started in Abu Dhabi?
I mean, the biggest thing is awareness. So they had already provided me with a good team to support me, experienced pediatric nurses and support staff, and we had always had a very lean team back in Canada. It was mostly just my colleagues and I doing most of the work ourselves, and so I didn't need an awful lot of support that way here. What it really was more is trying to educate the population and the local physicians on what we could do for them, how we could help them, and things that were then going to be very different for them. Again, most of the experience from the patient standpoint was you go to the allergy clinic to get tests done. And that was it. And the idea that we would ask them questions, that we would actually take a history and want to know the details around, whether it was a food reaction or whether it was their asthma, was foreign to them. They weren't used to, they would say, well, nobody's asked me these kind of questions before. And again, that was very much the same back home as well. So I nothing that unique if you're in an area that just hasn't had that kind of exposure. Now the patients, that have seen us or have heard about us, they understand now that, we're providing sort of a different level of care, hopefully, than what they've maybe experienced previously. But it takes a while. That doesn't happen overnight. It takes a long time, and it takes sort of repeat message. And then when you're doing something that is really unusual in the area, like food challenges, or now starting the immunotherapy program that we've been doing in the 5 years here, those are completely foreign concepts to most of the physicians and all of the patients.
So when you go to conferences in the region and talk about your successes and challenges regarding, let's say, oral immunotherapy in this case, what are the sort of type of questions from your peers and colleagues that you get, and how do you overcome that challenge? Because it's not easy. You've seen it in 20 years of your practice working, but it's new here.
So it's a good question, and it's a double-edged issue for sure. And that's because first, the initial response from a lot of the doctors is a little bit of shock, a little bit of, wow, you're doing that here? Wow, good for you. That's awesome. They're impressed, but they're also intimidated and scared, and they're thinking, there's no way that they could do something similar. And then the flip side, I want to provide the reassurance that we're not doing something crazy here, that we're not renegades, we're not, cowboys. We're doing evidence-based practice. I'm always presenting the data that we've published in, peer-reviewed papers, in peer-reviewed journals. And I'm trying to reassure them that what we're doing is a safe and reasonable approach. But I also want to temper that. I don't want people who are, whether they're allergists or not allergists, I don't want people who are relatively inexperienced in food allergy thinking, oh, well, I can start doing immunotherapy. So while I want, especially my allergy colleagues, to consider this option, and I would love if more of them started to offer immunotherapy, I want them to start with the basics, which is, if you're not doing food challenges in your clinic, you have no business doing food immunotherapy. So, you have to take it one step at a time. You've got to make sure that you've got a proper food allergy practice, and then you can incorporate immunotherapy as one of your management strategies. But I don't want people starting to do immunotherapy on people who aren't even allergic just based on testing, right? You've got to have a proper diagnosis. And I don't want people who say, well, in my clinic, I can't really do food challenges. We're not set up for that. I'm not prepared to treat an allergic reaction. Well, then you have no business doing food immunotherapy. You have to treat it with that same respect that you would with a food challenge or diagnostic drug challenges or, any
Or
other procedure.
vaccination adverse reaction.
Well, I mean, yes, I mean, I've made that argument for years that we do a lot of things. A lot of doctors do, immunotherapy injections, which is much riskier than, food challenges or food immunotherapy in most cases. I mean, some of the worst anaphylactic reactions I've seen in my career were from injection immunotherapy, subcutaneous immunotherapy, rather than, food challenges or food immunotherapy. But again, the doctors have to have that comfort and expertise. And so I don't want people to start thinking, oh, well, I can just start doing immunotherapy. So, I want to make sure the word is getting out. I want to empower people to know that this is something that they could incorporate into their practice safely and successfully. But I also want to make sure that we have the right people doing it, which means these should be people with experience with managing food allergy, with managing allergic reactions, with dealing with risk management, talking to the families. I mean, again, these are families that are often very nervous and often terrified to start this kind of treatment. And that's understandable. And we have to be able to then be able to reassure them and help walk them down that sort of pathway. It's not always as easy as it sounds.
On the website of your practice here, I saw that there is a psychology part of the practice. To what extent is this incorporated in your OIT program?
So far, and that's also a really important topic. So far, not, and that's only because so far, so the psychology part of our clinic is a distinct and separate part from the allergy clinic, much like the dental clinic is a separate part. I would love to have that change over time, but we have not so far had a psychologist with either a primary pediatric focus, which would, I think, be important, or a food allergy background or expertise. So either incorporating a psychologist or a dietitian with that sort of level of expertise who could provide that kind of support for the families, I think would be awesome. And I would love to have that. The problem, again, in the region is we just don't have a lot of bodies with that sort of background. And so then you run the risk of, even with, for example, a dietitian, if they don't have any personal expertise or experience dealing with food allergy patients, and then you may end up getting, conflicting advice, mixed messages, and you may end up just confusing the patient further. So I would love to have somebody with expertise in psychology who could support what we're doing. I think that would be awesome. But so far that hasn't been a possibility yet. But I'm optimistic.
So all our listeners, if you have skills in this area, send Dr. Ca your resume.
Although, it's funny because a lot of the families are not that anxious, and that's actually been like, I don't know, a lot of them it's just like, yeah, no, it's fine, it's fine, it's fine, it's fine. But then you get a few where they're really, really anxious. But I always tell them the same thing, which is that the first dose or two, you're going to be a bit nervous in that, and then by the time you're here for the third or fourth up dosing visit, you're just going to go, yeah, it's fine, it's fine, it's fine. Just give them the food, and we'll sit for a half hour, and off we'll go. Yeah.
We've built a community of parents and in our program in Australia, and it's interesting to see how that support system amongst families actually helps mums in particular overcome some of the anxiety. In your clinic here, is there any support system for parents who join the program?
So not formally, and again, it's something that I've thought about, and it's always
double-edged sword.
It is. It really is. Patient support groups. I've had some bad experiences in the past, not with anything that I organized, but there's some good evidence that the thought with sort of patient support groups or patient advocacy groups was, people could get together and they would sort of, by their shared experiences, they sort of revert towards the mean. And studies have suggested that for a lot of these kind of issues, in fact, what ends up happening is a lot of times these groups can be more polarizing rather than everybody kind of finding a happy middle area. What happens is you might get a few people who have had, either more, negative experiences or possibly more positive experiences, and they will, it starts to become a little bit of a competition. Well, I did this and then I did this, and now you're getting way out towards the fringes, and support groups can be taken over very quickly by a few strong personalities that may or may not have the same goal or motivations involved. And I've seen this with food allergy support groups historically. Parents say, well, and then I got my school to do this, and then I did it, and then it's like this very tricky game that I'm like, I don't know about that. That's not necessarily the best approach. Now, I mean, if this was something that we set up here with our families, I suspect then the messaging would be kind of more similar. And I haven't. What I have done though is I've had a very few families that just needed to talk to a family that had been through the process. And I've got a few really, really gracious families that have already been through, have maybe even finished their exit food challenges, who are more than happy to act as ambassadors and just have that quick conversation with a family about, well, this was our experience. This is how I felt when we started. And then this is how it went. And this is where we're at now. And I know that that's made a big difference for a few of my families. So, having that more formalized, might be a nice option too. Man, it just seems like there's not enough hours in the day to do all the things that you'd love to do.
In this society, it seems that food is everywhere you look, but it doesn't seem that food allergy families have enough easily available resources to make an informed decision if some food is safe for them or not. How do you see this developing in UAE at the moment?
Yeah, I don't think there's a good structure in place. I mean, the government has identified priority allergens, and the schools have pretty reasonable approaches to it.
Is there an action plan, or
there's not a universal action plan? Every school has their own forms that you have to fill out every year, and they all have their own different sort of protocols. And it would be nice to have some of those things more uniform. But there's no doubt one of the problems we have here is we have food coming from all over the world, and they all have different labels, and there's not a sort of uniform approach to food labeling the way there is, in the European Union or in Canada. And, we have, very specific rules and regulations that our patients can rely on. And here, there, I know our rules in place, but I also know just from looking at products in the stores and in the markets that there's lots of products that are not labeled to my satisfaction as an allergist. And even a lot of products where the sort of local label that's in Arabic with the Arabic information may cover up the ingredients in English or another language. And that can be problematic. And then even in things like the restaurant industry, the range of understanding and appreciation around allergy in general, food allergy specifically, identifying priority allergens, even the words for certain allergens, again, because of the language barriers. And you've got now staff where the staff in the kitchen may only have, a couple of people that speak English. And now somebody, from the waiters trying to get them to make sure that there's no, peanut or cashew, and they may use a different word for the food. And so there's no doubt it's a challenge. And I don't, again, see an easy solution. I know that there are efforts being made, but I don't know kind of what progress is being made with that, to be honest.
And what's your future vision for your clinic? In UAE now, there are 2 clinics which offer oral immunotherapy. Is that correct?
Yeah. So Cleveland Clinic is started doing some food immunotherapy. I'm not aware of any other clinics so far. So if there's any others, I'd love to know that, because that would be good. Do you know of anyone else currently doing immunotherapy besides?
No,
Okay.
just these two. Yeah.
Yeah. Okay. And that's good, because I mean, I've been trying. I've talked to a few of my colleagues in Dubai, and I've tried to encourage them. You could start doing it, and a few of them, they send their patients to me instead. And I'm like, but you could start doing it. You do food challenges. You could do it, but again, there's logistical issues. I'm hoping that as the data evolves and it becomes more accepted as standard of care, some of those barriers will fall to the wayside. One of the other barriers, and it's not to be dismissed, is insurance. The insurance system here is very much like the American system with private insurance, and insurance payers are not necessarily inclined yet to recognize oral immunotherapy as a priority that needs to be reimbursed. And so for a lot of patients, they end up having to pay out of pocket to do the immunotherapy. Now, for a lot of them, it's well worth it, and the costs are not exorbitant. Again, especially, the most of the costs are during the build-up phase, and it's a relatively short build-up phase that we tend to employ. But I would like to see it being accepted as more mainstream. I'd like to see more doctors not just offering it, but even at the primary care level, being aware of it and knowing that their young patients, especially young patients with food allergy, have an option other than avoidance and carrying an EpiPen, so that they can at least encourage them to have the conversation with somebody offering immunotherapy, whether it's myself or one of the other clinics that's doing it. The more clinics that are doing it, the less it looks like a fringe activity, and the more it becomes part of the mainstream and accepted. So look, we've got a large population here. If I remained the only person doing it, there would never be the capacity to offer it for all the people who could benefit from it. So much like back in Canada, we want other people to start doing this, but we also want to make sure that it's being done safely and appropriately, and for the right patients. And that takes some practice and experience. And for some of the doctors, some of them may need to, work with somebody who does immunotherapy to get that experience. They may not be comfortable doing it unless they've had, a bit of mentorship in that area.
And how many patients do you have right now doing OIT?
So, I mean, at any given time, we're again, the build-up phase is about 3 months. So we probably have maybe 20 or so patients doing the up dosing. And then we've got, maybe another 50 or so that are on maintenance treatment. And we've already had about, I don't know, maybe 30 or to 50 patients who have finished and have had exit challenges, and most of them with a lot of success. So, we're not talking about huge volumes, but for those patients, I mean, it makes a tremendous difference.
It's a huge difference in the quality of life. And thank you so much for sharing your story of pioneering a standard of care, hopefully in this country.
Hopefully it's going to make a difference. And the more this becomes standard treatment, I'm so excited when I saw that Australia is now rolling out a nationwide peanut immunotherapy program for young children. I mean, that's like, we couldn't be happier when we see things like that, because it's very rewarding to see this message becoming more disseminated and accepted, and for people to realize again that we've got options now, and having practiced for so many years before we had these options. Oh, I wish I could go back and change what we did then and to do now. It's very exciting time to be in the field.
Dr. Ca, you're already changing the entire Middle East. So thank you very much.
Thank you.